Morning, today is February 4th, Tuesday, and we're currently with the Health Department here, and present is Pam Hanna. And Pam, start us off, please.
Good morning. I guess the big thing that we've been working on for the last couple of weeks is related to pertussis. We have one case that's related to our county, so will be reported as a case in Jefferson County. However, we have 3 other cases that have affected a school. However, the people live in another jurisdiction. So we've had 4 cases of pertussis that we've been investigating in one of our schools. And that requires a lot of time and work. We haven't had a pertussis case since 2019. We've been watching pertussis because it's been circulating for the past several months. And it's kind of the first crop up of it since the pandemic. So we've kind of been watching. Lewis and Clark has had it, Silverbowl, Anaconda, Deer Lodge, all the little places that we connect to. And so it did come to us. We thought we had kind of had it contained, and then we were notified of this 4th case yesterday, which falls in that incubation period. It's 2 weeks after we were notified of those first cases. So we're trying to watch that. We also have parapertussis circulating, which is a similar illness, but it doesn't have the same parameters that pertussis does. It doesn't induce the same kind of illness. It's still treatable in the same way, but it also doesn't have communicable disease law attached to it. Pertussis does. So there are certain things we have to do according to Montana state law with pertussis, like exclusions. With parapertussis, we don't have those exclusions. So we're doing the case investigations. We're following illness surveillance on pertussis is 21 days. So 3 weeks past that confirmed case. So our 3 weeks, our clock is starting over again with this new case. So we've provided information to the schools. We've provided information to our healthcare providers. We've been working with the state and of course with our health officers. So that's kind of the big thing that's on our plate right now. We've also seen quite a bit of influx of influenza. Part of it, I think, is we're doing some testing because we've got these other respiratory illnesses, but we are seeing our flu numbers become elevated in the last 2 to 3 weeks. So I think we got 5 new cases yesterday. So we're right around 30 identified cases in Jefferson County right now. They're throughout the county. We really haven't seen it in our elderly population at this point, but we do have 2 babies right now and so we worry about them. We've only had 1 hospitalization. So that's the other thing that we kind of watch on that.
And what was that?
Influenza.
Influenza.
Okay, that's what I thought. I just want to
And
make
it's
sure.
mostly influenza A. We've had 1 influenza B. We start to think we might see some B coming in this time of year, but so far we haven't seen a lot of B. It's mostly been influenza A. So, and we've had a few COVIDs, but mostly it's been other things. And we had a case of RSV the other day too. So we're seeing a significant amount of respiratory illness. And we did do with our school partners, our clinic partners were invited and didn't end up attending a measles tabletop because we feel like, kind of the harshest communicable disease that we would have to deal with would be measles. And there is some of it that's circulated in the United States. Idaho has been some of the closest cases. So we did do a measles tabletop just to kind of do a practice of what we would do, how we would report, who would be responsible for what. And that was really it was very interactive with the schools. All of the school nurses attended. One of the school administrators attended, so we felt really happy about that. As far as reaching out to the clinics, their barrier was that they need to provide services, especially this time of year during clinic hours. So I think what I might do is schedule an appointment with the clinics or see if they have a staff meeting that I could come to and just talk with them, kind of go over some of those points of what we did in that tabletop and talk with them a little bit about communicable disease reporting and how we would collaborate and work together. So that's a big thing with that.
What's the symptoms for measles? Is it
What?
a rash, measles, what?
Measles, it's a fever
A fever?
and a rash, and it generally it's like if you had a bucket of red paint poured on your head and it would start at the top and come down. So a lot of people, I mean, rashes are hard, and a lot of people hear or see rash and think measles. In fact, we had one provider test for measles about a month ago. It ended up not being measles, but as soon as we hear the M word, we're pretty, we don't even say it usually. So yeah, so generally it's high fever, rash from the top down, and sometimes they have white spots, what we call Koplik spots, in the back of their throat. And those are really the three big indicators of measles that, you know, are diagnostic signs of measles. And then of course you would test, so. But the thing with measles is it's the most contagious communicable disease we have. It's got a really high R naught, so and it's airborne. So you know, if you've been in the room with somebody who was there 2 to 3 hours ago, it could still be in the air. So that's the thing. I'm still working with Butte Silver Bowl on the crisis diversion funding, the grant. So this was the MOU that they sent, and I sent it on. I am meeting with the whole regional group next Tuesday at 11, and they are sending it through their channels, so through their legal authority and through their Board of Health, and then they're going to want signatures from the smaller. So Bill Devil is their behavioral health coordinator. He'll be the one working with us on crisis diversion and behavioral health from Butte Silver Bowl, and he's coming over tomorrow to meet with me at 10. So I didn't know if you guys had any questions, if you wanted to talk with him, but he is going to be in my office tomorrow at 10. You're more than welcome to stop by, see him, send me an email or
And
information.
this is the guy who's doing all that from Butte.
Right, so he's their behavioral health coordinator.
Yep.
So he will be the one kind of running the show with all of this. And one of the things that Bill wants to talk with me about tomorrow is scheduling a mapping, a SIM mapping event where we pull all the partners together, have a contractor come in and talk about, you know, what is going on here. What strengths do we have? What barriers do we have? What are our opportunities to do this kind of work, and what's the need for it? So, and that's where I've kind of said, I'm probably going to need you guys to help me with pulling partners in. So we would want a commissioner there. We need somebody with, you know, decision-making authority. We'd need legal there. We'd need, of course, law enforcement there. We'd need the schools there. I think I'm going to have a pretty easy time getting them there. EMS, probably not have a problem getting EMS there either. But those are some of the partners we're kind of looking at bringing to the table for this. It doesn't have to be all of you or all of law enforcement, but we need representation from them, and probably Steve or one of his people needs to be there. I'm going to ask Sarah Iyer to be there because she would kind of represent all the schools. And then I'll open it up to anybody else who'd like to. With EMS, I'm really hoping that Drew would come, and Molly, because she's Boulder's coordinator now, and then somebody from JV EMS if they would come. And maybe even if we could get St. Pete's or A1 to send somebody. And I don't know if that's a possibility, but they respond for us. So That's what I'm thinking. So we need to kind of look at a date. And, that's kind of what Bill and I will be talking about tomorrow. So if you've got thoughts or concerns or ideas, they'd be appreciated for that.
Try to stay away from Tuesday if you want a commissioner there.
Yeah. I don't know if Wednesday's a good day for folks,
Not
kind of
for
middle of the
legal.
week.
But
Not for legal.
yeah, Wednesday, the
Mm,
district court
yeah.
day.
Okay.
Depending
So,
unless
so maybe
Steve
Thursday,
is fine, he might,
or Thursday's a more open day.
Just depends on the time.
in the morning.
Yeah, well,
Well,
Monday.
the afternoon I'm busy, but
what I envision doing is throwing out 3 or 4 dates.
Okay.
And
Doodle
we
poll.
do
If
majority.
you got a bunch of people that doodle poll. works
Right.
really good. If you-
And of course, we've got to coordinate with the contractor too, and I don't know what her schedule is. When I talked to her the last time, she was about a month or 2 out in her schedule. And I don't know what she's looking like now, so.
And we can work around, one of us can be at a meeting at pretty much any time, I think.
Okay.
Even if it ends up being on a Tuesday, one of us can cut out of this meeting.
Well, Mondays don't work good for me. It's manic Monday and I know Tuesday's busy. If Wednesday's court day,
well, on Wednesday, it wouldn't matter as long as Steve doesn't have anything on the docket.
Right.
That would be up to.
so we'd throw the dates at him, maybe do
It's
some.
usually Andrew who
Wednesday,
has
yeah.
problems on Wednesdays.
Okay. All right.
It's like herding cats.
I
Good
know,
luck.
grasshoppers.
Yeah, that too. Yeah.
And then our building situation. We actually aren't gonna go to Whitehall today. We don't have appointments. The roads aren't good. We've got all this Pertessa stuff, so we're not gonna go down. But I will go with Tana next week so that I kind of can get a feel for what's going on. Steve sent that letter and we've all kind of looked at it and talked about it. So I talked with Mary last week. She was out of town, but she said she'd work on the town hall situation starting this week. So I sent her a sample of the contract that we now have. So she had some kind of an idea or something, you know, a template to go with. And she said that she would work with her lawyer to get something drafted. So that's where we're at, but I still see that being the end of the month before we have anything signed.
yeah.
We have a health board meeting on the 18th, so I'm hoping we have things in line so that we could have it signed and talked about that day. I don't think they'd have to do a special meeting for it. I think if we at least talk about it on the 18th, even if paperwork's not done, they can make any decisions. And then Christina's always good to stop if we need her to sign stuff.
Okay.
So Craig, are you able to come to that?
I should
meeting?
be,
Okay.
that's what if you'll just send me,
Yeah, I'll send
put me
you.
on the list or.
And I think we've got it at 5 or 5:30.
The remote option to that.
Yeah, I have it on our schedule at 5 on the 18th, and we'll be at the health department, just in our lobby. And then, let's see, what else? Legislature's on, so kind of looking at some of that stuff. There is a bill in this week on Friday that we're watching closely. In the 21 session, they took public health's ability to collect immunization data from the schools away. And one of the bills that they passed. And so basically it has suppressed data. And Montana is the only state that doesn't have that data out on the national level. So we're trying to get that back so that we have that data. So we're looking at that. There's a big one related to environmental health where they're trying to get establishment fees put in place so that we're charging a little bit of a more of a fee for when we do licensed establishment inspections, just because counties are going in the hole for that work. it's affecting the larger counties, of course, more because they have more establishments. Our licensed establishments are generally contracted. That's not something Megan usually does.
Right.
So we have a contractor that comes in and does that. There's a vaping bill we're watching right now too, so with the Clean Air Act. We expect there's gonna be several more vaccine bills that are gonna hit in the next couple of weeks. And generally, they asked me to come testify sometime, so I cleared that with Steve and he's fine, and I usually do it under AMFO, under the board, the Public Health Board, not necessarily under Jefferson County. So. They are making some changes with our FAP, so Emergency Preparedness Grant, which will trickle down a little bit to us. Some of it is related to budget, but their section, their department head is leaving too, so we're kind of watching that. We're also not sure with the federal or national administration's hold on funding, possibly what that's going to do with our grants. So MCH is our big federal one, but FEP and IAP money also come through the federal avenues. They're administrated through the state. So we're all kind of watching whether we have money, whether we have money.
Can you tell me what those acronyms mean?
So FEP is Public Health Emergency Preparedness. So that funding, we get around $36,000 a year. And a good portion of that pays Jesse's salary.
Oh,
And then the other portion of that, we do emergency preparedness work with. We've done a lot of like our CPR trainings and Narcan trainings with that funding, because then we can provide them free of charge to the public. Those sorts of things we use FEP money for. And then the MCH is the Maternal Child Health Block Grant. And that's the one that comes straight from the feds to us. It's on a different federal, it's on a federal fiscal year, so it's a little bit off. We get about $8,000 with that funding. And this year I dedicated all of that to Erin's salary, because the deliverables we're doing are all related to school and daycare. And so I'm using that all for her salary. Of course, she has other things that do her salary, but it's kind of a hard budget grant. And so I think this might simplify it on our end, on my end, on Ginger's end, if we have all of that going into one thing and not taking it out of other things. And because I use some of the immunization money, which is the IAP money, to do salaries this year, because I had extra that I could use for that, I was able to take some of the supplies and education that I usually take out of MCH out of the general budget, because I had offset the salary budget out of there. Next year, I don't know what'll happen. So then the IAP grant is the immunization grant that comes from DPHHS's immunization program. And we get about $13,000 a year with that. And except for this year, we got 70,000 or 67,000, something like that, because they had surplus that they kicked back to us. We are also hearing, we thought we had to have all of it spent out by the end of this year, but it looks like they may extend that till 26 or 27. So we're waiting to hear on that. And that money, Tana's salary comes partly at someone's salary comes out of that. Some of Molly's salary comes out of that, because they're directly related to immunization. Tana's our immunization nurse, our main one. And Molly is our vaccine coordinator. So she does all our vaccine inventory and billing and tracking. So they can be paid out of that. And then we can't buy vaccine out of it, but we can buy supplies, and we can do education. Every April, we do a conference that the immunization program puts on. So we pay for our training out of that. So some of those things are what we use that money for. So. That money also pays for a training an annual training we do. For public health and emergency preparedness, so.
How long does your mill levy last? Is it a 4-year mill levy? I can't remember.
What's that?
Your mill levy that your office is paid through, is that?
So a lot of our other funding comes through our mill. I asked for it to be used, was it last year when I thought I was gonna lose, to have it available in case I lost Jesse. But I didn't lose Jesse, so, but yeah.
Cause that's a tiny mill, like, it ran out one year and we forgot to put it on
Right.
the ballot and we were a year without.
And I wish it wouldn't sunset.
Right.
I wish it was, cause
Like a
every
permanent levy.
5 years I get really anxious that. I'm
Well,
not
there's a
gonna-
bill out now where they're gonna sunset everything after 10 years.
Every levy, yeah. That's what they're.
Every
working
mill
on.
levy out there is gonna sunset at 10 years.
At 10 years.
Mhm.
That's the bill. I don't know what it's gonna do.
Well, that would give me 5 more years and I could get retired, so I might be okay with
Yeah, there
that.
must be a reason, the health department's only 5, there's gotta be a reason for that,
It used to be annually, Molly said,
really.
Yeah.
but it
years
used to
ago.
be annually and
Wow.
then, they kind of petitioned for it to go to a 5-year cycle, which. And honestly, I mean, I look at my tax bill and it's less than the price of a vaccine, what we're paying for public health,
Yeah.
so it's like. So last time I was really nervous about it because it was the first election after the pandemic and I didn't know what reception we'd get. And I can't campaign for it, but my board can, and so I think. Looking back on that, I'm gonna have them be a little more interactive in providing education and information about what it is and what it does and,
Okay.
but I think we've got a couple more years before we have to worry about that. Then the other big project we're starting to work on is that Pathways project. So we got the first initial funding for that. And I have a meeting next week to start that process, so.
Okay, good. Great.
So that's what we're doing.
Need some more projects?
No, no, I kind of wonder why I've taken on the project I've taken on anyways, but anyway. Oh, and they are doing some Brownsfield funding with remediation out at Clancy. So far, it doesn't look like it's really gonna affect business upstairs. It just looks like it's, but we had some things in storage down there that I pulled out and we relocated, so.
Yeah.
We're busting at the gills again in our office because there's car seats everywhere, so I think I'm gonna put an ad in the paper and say, we have car seats, come get them.
Good. Thank you, Pam.
Yeah,
Appreciate
thank
it.
you.
Do you have anything for me?
I don't think so.
All right, well, thank you. I appreciate your support and I appreciate the support with the Whitehall
Yeah.
building thing. And
Might turn out to be a better deal for you.
I think it will be in the end. I just hope we can move forward fast enough that we keep all the other partners happy.
Yeah.
We don't have that to worry about. All right.